Hey sir, my name is Caitlin. I'm going to be your student nurse today. Your doctor has ordered a head to toe assessment, which I'm going to perform on you. Before I get started with that, can I get you to verify your name and date of birth for me?
Nate Fairs, 3892.
Thank you so much. So before I go any further, I'm going to provide privacy. I'm going to do hand hygiene, put my gloves on, and also verify my orders. So upon general inspection, my patient looks well groomed. I don't notice any he looks conscious, alert, oriented. So far, he's been able to respond to me, so that tells me that he has no issues with his speech or his hearing. He's making eye contact, so I don't see any kind of vision concerns. So what I'm going to do now is start with your head, and I'm just going to palpate lightly just to check for any abnormalities or deformities. While I do that, I'm also going to assess your hair, make sure there's no patches of skin showing. And also just make sure that everything's okay. Are you all right if I do that?
Yes.
Okay, you let me know if there's any pain. Okay, so while palpating, I don't notice any patches of skin or anything like that. No dry scalp problems like that. His hair matches his ethnicity. So then I'm going to move down just a little bit. So just looking at his face, I notice that his face has overall general symmetry. No abnormalities noted. His eyes look the same in shape and size. They line up, the corners of his eyes line up with the tips of his ears. His nose doesn't show any signs of abnormalities. It's pretty symmetrical, no issues there. His lips also look like they're doing really good. They're pink in color. I don't notice any kind of tears in them. So I'm going to move on to your eyes. Now what I'm going to do is shine a light just to check your pupils' reactiveness. And then I'm also going to do an accommodation test where I'll have you follow my light. So I'm going to measure your pupils before we start. So I'd say they're about a 5. And his iris are blue in color. So again, just shine it real quick. And that one dilates to about a 2. Same for this one. And okay, I'm going to hold it out here if you just follow it as I bring it in, okay? All right, so your pupils did accommodate. Now, have you recently had any kind of head pain, trauma, or anything like that?
No.
Have you had any vision issues?
No.
Okay. Have you had any hearing loss or problems, ear pain or anything like that?
No.
Okay. Have you had any issues with like sinuses or anything?
No.
Okay. So what I want to do is perform a nose patency test. So if you just hold one nostril closed and blow out the other one and then swap for me. No problems doing that?
No.
Okay, so I'm also going to inspect your mouth. So if you just say, ah, ah. Okay, so your oral mucosa looks pink in color, which is very good. Your teeth look very well taken care of. I don't notice any discoloration, no broken teeth or decay. I also need to check your neck. I need to check your trachea. I'm just going to lightly put my fingers on it while you swallow. Okay, so your trachea seems midline, no issues. Now if you'll lean your head back just a little and turn your neck for me. Okay, and do the other side. All right, so no jugular vein distension noted. Are you having any problems swallowing recently?
No.
No, okay. All right, so I'm gonna move down. I'm gonna do a cardiac and respiratory assessment. Before I do that, I'm gonna check your skin. I'm going to check the temperature of your skin, make sure your color is normal throughout, make sure your hair is normal throughout, and also just check for any kind of edema by just lightly pressing on it. Are you okay?
Yes.
Okay. So I'm going to go up this arm. So your skin, it feels warm. I don't notice any discoloration. I don't notice any patchiness of the hair. Do the same on this side. And again, the same thing, warm to touch, but not too hot. No discoloration and no patchiness with your hair. Also no edema, no fluid buildup with what that would be. So next I'm going to check your hands. I'm going to check your capillary refill and also just assess the overall appearance of your nails. So they look clean. I don't notice any tears or rips or anything like that. No clubbing. And all your capillaries refill within 3 seconds, which is what we want. That's a very good sign. Next I'm going to listen to your heart. So place my stethoscope. Okay, so I'm going to start on this side and listen to your aortic valve. And then move to your pulmonic valve. And then your Erb's point. Your tricuspid valve. and your mitral valve. All of those sound good, so I'm going to swap and do the same thing. This time I'm listening for any kind of murmurs. I didn't note any, which is a good sign. If I can, I'm just going to hold lightly right here, and I'm going to check your pulse. Okay, I would measure that one about a 2. Well, no, probably a 3. It's pretty strong, which is good. I'm going to measure this side as well. And I would also note that one to be a 3, strong and pulsating. So for right there, you have those. And then you also have a brachial pulse, an axillary pulse, a carotid pulse up here, your femoral pulse, your popliteal pulse, and then you have 2 more on your feet, which would be the dorsalis pedis and the posterior tibial. So I'll check those later, actually. Next, I'm going to listen for your lung sounds. So as I place my stethoscope, I just need you to take a deep breath in for me, okay?
Okay.
Okay, so I'm going to listen to your right upper lobe, so deep breath. Your left upper lobe. Your left lower lobe. And your right middle lobe. Okay, and I'm going to check your sides, so your right lower lobe and your left lower lobe. And if I can get you to sit up, I'm going to listen from the back as well, okay? All right, so your right upper lobe, deep breath. Left upper lobe, left lower lobe, and right lower lobe. Okay, so all those sound good. No adventitious lung sounds, which is normal. Let's see. So what I'm going to do next is, I do want to ask, have you been having any chest pain or trouble breathing?
No.
Okay, that's a good sign. So what I need to do next is just check your abdomen. I'm going to listen for your stomach. So if I can have you just kind of lay just a little flatter for me. So scooch down just a little bit. Okay, and I'm going to pull your shirt up if that's okay.
Mm-hmm.
Okay. Oh, goodness. Okay, so your right lower quadrant is where we start. We would generally listen for 1 minute if we heard sounds. If not, we would listen for 5 minutes before moving. Your right upper quadrant, your left upper quadrant, and your left lower quadrant. Okay, now I'm going to flip and use my bell and listen right here for an abdominal aortic aneurysm. And I don't hear anything, which is good. So you can go ahead and sit back up if you'd like. One thing I do want to make you aware of is the Glasgow-Coma scale. So what we would do, if I had to give you a rating for that, I would give you a 15, which means that I give you a 4 for your 4 for your, hold on, so a 5 for your vision, because you haven't shown any signs with your vision, and then a 6 for your mobility, and then a 4 for your hearing, for your ears, which is good. The 15 is the highest you can go. Also, the Braden scale, we use that to measure like your skin integrity. And so what we would do to make sure that you're not at a risk for that, we would just kind of check your nutrition. We would check your activeness, and we would check your mobility. And another thing we can do to test it is just pull lightly up on the skin right here and watch it fall back. If it falls back quickly like it did, that means you're well and hydrated. And we can also check right up here under your collarbone, and again, the same thing. So you don't show any signs of dehydration. I do need you to lay that down just a little bit for me. I'm going to actually palpate your stomach. So I'm just going to push lightly, and you let me know if there's any pain with it, okay?
Okay.
Okay, so no pain?
No.
Okay, good deal. All right. Now, when was your last bowel movement?
today.
Okay. Did you have any troubles? Did it appear normal? No blood in it or anything like that?
No.
Okay. And when was when the last time you peed, did you notice any discoloration or strong odor or anything?
No.
Okay. All right, so I'm going to move down to your lower extremities. Again, what I'm going to do is just squeeze lightly up your legs and just check for edema like I did the top.
Okay.
Okay, so I don't note any edema there. And if it's okay with you, I'm going to slide your socks off so I can check those other pulses we talked about, okay?
Okay.
Okay, so your dorsalis pedis. I would measure that a 2, which is just normal. That's fine. I would measure your posterior tibial, a 2 as well for this side. I'd measured a 2 right there. And that one I'd measure a 2 also. So that's all good though. Again, a 2 is normal, so that's fine. If I can, we're going to move over to your musculoskeletal assessment. So if I can just get you to swing your legs off the side of the bed. Okay, so what we're going to practice is your range of motion in 2 of your joints. I'm going to look at your elbow and your wrist.
Okay.
So we'll start right here. I'm going to hold your elbow. Now if you'll extend it and then flex. So extend, flex, one more time. And flex. Okay, now I want you to do it, extend against resistance and flex. Okay, now we'll swap to this one. So extend and then flex, extend and then flex. Okay, extend against resistance and flex. And then we'll do your wrist. So I'm going to hold it. All right, so I need you to hyperextend, extend, and then flex. Hyperextend, extend, and then flex. Okay, against resistance. One more time. All right, we'll do this side. So hyperextend, extend, and flex. Hyperextend, extend, and flex against resistance. And again. Okay. So next I'm going to move to your knee. So if you'll come out just a little bit for me. All right, there you go. So if you'll, okay, so I want you to extend it and then flex it by pushing it back. Okay. All right. And then against resistance. One more time. Okay. So do this one for me. Okay. Is that popping normal?
Yes.
Okay. Was there any pain while you did that?
No.
Okay. All right. If you'll push against it for me. One more time. All right. I'm going to move down to your ankle joint. So what I want you to do is dorsal flex, which is up, and then point your toes down to plantar flex for me. Okay. So up and then down. Okay. And then against resistance. All right. And let's do this foot. So dorsal flex, plantar flex, and then against resistance. So I'm going to wash my hands. All right, now if you'll stand up, what we're going to do is test your balance. We're going to do this performing a Romberg's test. So I'm going to hold my arms out to the side of you. I need you to close your eyes and just try to stay still, okay?
Okay.
And we would typically do this for 20 seconds. Okay? So next we're going to look at your gait. So I'm going to have you turn around, and I just want you to walk like normal. And come back for me. All right, and then one more thing. I just need you to perform a heel-toe test for me. So walk heel-toe, heel-toe. Okay, and you can come back. All right, and other than that popping, do you generally have any kind of joint pains or problems like that?
No.
No? Okay, you can sit back down. All right, and I'm just going to double check everything really fast. Oh, I do need to check your capillary refill on your toes just like I did your fingers. Okay. And those appear normal. They refill within 3 seconds, which is good. Yeah, wash my hands. You said no head pain or anything like that, right?
No.
Okay. Okay, one thing I did forget to do was go over cough, deep breathe. A cough and deep breathe technique, which is really important, especially in a hospital stay, because we don't want any kind of lung infections to form. So every 10 times every hour, what we want you to do is practice taking a deep breath. Take it in, hold it as long as you can, and then blow it out. So if you can just show me that. Okay, and blow it out. All right. And again, you want to do that 10 times every hour. If you feel like you're not getting anywhere, we can bring in an incentive spirometer. It's a device, and we'll set a goal, or the doctor will set a goal for you, and you'll take that deep breath in while there's a tube in your mouth, and it shows on the spirometer how well of a breath you're taking in to let us know how close you are to your goal. Another thing you want to do is turn, so that any kind of buildup in your lungs, it helps break it up. And also you want to turn into your elbow and give a good cough, get any of that mucus up. Can you do that for me? Okay, and I don't notice any kind of sputum coming up, which is good. It means you don't have anything built up in there currently. So other than that, everything else seemed to be great. I'm going to let the doctor know, and he'll be in shortly to assess you, okay?
Okay.
All right, thank you.